Okay, good morning, everybody. It is January 15th, 2021. This is our weekly Friday morning COVID check-in meeting that we have been doing all along. I'll start by reading our vision statement. The Ashland Public Schools cultivates the academic and social-emotional growth of each student through a supportive, collaborative, innovative, and challenging environment. Students will develop into self-motivated, resilient, lifelong learners who embrace their role as responsible contributors to a global community. This meeting is being recorded by WACA Cable TV this morning. And our order of business, the same as every Friday, we call to order, open the session, opening procedures, agenda review and adoption. There will be time for public comment. And if you are here and you want to offer comment, we'll do that at the beginning. And everybody who wants to speak will have up to 3 minutes to share with us whatever you would like us to know. Our administrative items include the COVID-19 update, phases, models of learning, status of athletics, and then we will adjourn. So I will just take the roll call and make sure everybody is still okay with this weekly order of business, starting with you, Kathy Bates.
Here and yes.
Mark Terry. I see you. I don't hear you.
Like he's frozen.
He looks like he's frozen. So I'll move to you, Aaron.
Here and yes.
And Paul.
Here and yes.
And hopefully Mark will.
I'll try to ping on and see.
Yeah. But we can get started. And I'll start. I know we have some guests this morning. I don't know if any of you were hoping to give some comment, but this would be the time to do that. If you would like to give a comment, please raise your hand, either so in a way that I can see it or through the Zoom feature, and I will call on you to speak. Or one of my colleagues can help me out. I'm using a new laptop today. My husband's and I can't see everybody yet. I'll figure it out, but if you are here and you would like to speak, you can also unmute yourself and let me know so I know that you're.
Sorry, I wanted to say something.
Okay, I do see you.
Yep.
And on my screen, Karen, you look like you're sideways. Is that the same for everybody
No,
else?
she's good. She's good.
Okay, so it's me, but I'm sure I can hear you. So I will ask you to please just get started with your comments.
Okay, thank you. I just wanted to
Thank
say
you.
that it has been 8 weeks now since one of my kids has been to school in the high school. And I don't want to get into the specifics of the toll that's taking, but I just want to say that my own opinion, this is just my opinion, that if it's safe as a town for the other schools to be in the hybrid model, that I really at this point would hope that the high school can go back to the hybrid model as well. Thank you.
Thank you, Karen. Is there anybody else who would like to share a comment?
Chaz, I think you had your hand up.
Yeah, hold on, let me put that down. Yeah, my name is Charles Alberts. I'm a math teacher at the high school. I just wanted to quickly try to add a little context because I'm sure you're going to talk about the testing that was done on Monday. And just as a math teacher, I love data. I love interpreting data. I just want to point out for people who are not aware, just to make sure that we're interpreting the data in context kind of appropriately, that for the testing on Monday, we kind of asked to make sure, or it was asked that only people who had no known COVID contacts, who were feeling well, went to the school to get tested. And just kind of additionally, from a stats point of view, that's kind of a voluntary test as well. So in the sense that only to get healthy people with no symptoms and no contacts to go get tested voluntarily are probably still tending to be the most responsible people. So when you look at the test results, I just wanted to be careful that they weren't being interpreted as representative of the entire town. But so that was just my 2 cents. I have no comment as far as what you do with the data. I just wanted to add that if I could. Thank you.
Thanks, Chaz.
I think we have Mark back now on his phone, so just
Yeah, who also is sideways to me, but that obviously that's a problem on my end.
Is that better?
It is better for me.
Yeah, I'm having network problems in my office. So I'm on my cell phone, so it's going to bounce.
Oh,
around.
bummer. Anybody else during this public comment period want to share some information with us? Anybody? Okay, so seeing none, hearing none, I will go to you, Jim, for the update.
Great. Thank you.
Thank you.
And, I'll just start right there. I'll pick up from Mr. Albert's comments. Just make it keep it simple while we're there. Part of the reason we're looking for folks who are well coming in is obviously we're trying to track the asymptomatic carriers as well. And that's one concern that we have is that we do have folks who are asymptomatic, and we've been able to, at least with this testing, identify some that were asymptomatic. So that's a good thing, within the system. And while we're wearing mask and physically distancing, that helps mitigate any of those transmissions within the schools. So that is important. I would say I agree. I mean, many people who are doing the right thing did come in to get tested, but the more tests, the better. In terms of our view of this, we had 471 tests that were taken, and we ended up with 4 positives out of the group. So that's identifiable, at least of those individuals who are now quarantined and their families are quarantined, et cetera. So that's not a bad thing. Certainly, we've seen over the course of this past week, a precipitous decline in the number of cases, even in the town. So, that 2 weeks after the January and December holiday break certainly impacted the numbers we had. And part of the reason why we were remote at the high school was because of that. Those numbers are declining and people coming back to school. Clearly this week we've had to focus on a couple places. Warren and had a community case that impacted the school, and Pittaway last week. So I will share with you our weekly data right now. And what you'll notice is that, trying to make it a little bit bigger, apologize. What you'll notice is our week cases. This week there were 60 total cases, but what I want to emphasize is it's down 56 cases from the prior week. And here's January 1st through last Friday, January 8th, those cases. And then you'll notice that we had a number of cases here. The 11th was a big day, but other than that, it's been right around in the community, between 3 and 7 cases, 3 and 9 cases since last week, last Sunday. If I was just to run the data for the week, our cases per 100,000 would be about 20, maybe 23, 24 per 100. It dropped down pretty significantly. What I think is important to notice is that while we had 38 14 to 18-year-old cases in a 14-day window, it's this area here, right? It's that 1st through the 8th where those cases came. The last 15 cases, and Ed, and you can correct me if I'm wrong, but I looked at that data this morning. The last 15 cases that have come into the community have not been school-related cases. They may impact the schools in the sense that someone in a family may be positive and now we have to quarantine kids, but it had not to do with our staff or our students. This being said, also, if you look at our quarantine numbers, we have 141. 49 of these will be coming off from quarantine on Monday, so they'll be back in school on Tuesday. That goes back to these numbers over here from the 2nd, 3rd, and 4th, and 5th, really, those students and community members who were quarantined. And then we have, I counted up another 50 plus that will be coming travel related over the next week. We don't have all of, and this is part of the work the nurses are doing, and I applaud them for their effort. We have a policy in place that if you want to re-enter school, if you've traveled, you have to take a test after 5 days, a negative PCR test. And so with the number of folks that did travel, our nurses are tracking and trying to track down all of these tests, and or you can quarantine for the 14 days. So some families are deciding to quarantine without taking the test. So we're just trying to track down those individuals to put in our spreadsheet who will be returning when. So it's a lot of work on their part. When we talk about contact tracing, that's one aspect that we probably haven't emphasized enough, is that trying to find these families, track them down, get their test results, and or find out if they're just going to quarantine for the 14 days and not take the test. That's in addition to when we have a positive test of quarantining and contact tracing. So thank you to the staff for that. You'll notice that across the state, again, the positivity rate went up almost by 2 percentage points. It went up 2 percentage points over that period of time for us as well. And again, that's because of the number of cases previously in the 14 days. I guess what I'm getting at is I feel very comfortable, Audrey and Ed, please weigh in here, that Ashland High School move back into the hybrid model next week. As I've always indicated, the weekend can impact things, right? I mean, let's hope that the trend of the last 3 days, especially in the 2 days prior to our testing on the 11th, that we were trending in the right direction as a community, where we're seeing less spread within the community, which is the number of cases you can see over here is happening. So athletics then would start their practices on Tuesday as well, and with their tryouts. And I guess that's really pretty much where we are from the data standpoint. I can get into a couple of other things after, but I'd rather do that after you get questions about the data.
Jim, could you speak to the teacher quarantine number? I think last week that was 3.
Sure.
16, what the impact of that is.
Yeah, I was thinking the same thing.
So it hasn't had an impact within the actual within the actual running of programs or buildings. It could include teachers, but also instructional assistants. As I said, we have a full room closed down for remote only at the Warren School, Pitaway. We had a couple of educators test positive, paraprofessionals at the high school. They're remote. So it hasn't impacted the overall operations of our buildings.
Thank
and
you.
Actually, they'll be coming back off by the time we open up as well.
Thank you.
Other questions for Jim on the chart? Okay, Jim, it looks like you can move to the next piece then.
Yeah, so the only other, Ed, Audrey, do you want to chime in? Because obviously we want your opinion on this stuff. And I know we talk every day, but not everyone hears our conversations about where we feel comfortable or not comfortable opening buildings and doing things, so.
Yeah, I agree with reopening the high school to the hybrid level for next week.
I would agree as well.
So Audrey, would you say our staff up there is in good shape in terms of any of the tracing we've had to do? I know they're still stressed out, but when I saw Maureen yesterday, but it's more the travel stuff she's trying to track down from what she told me yesterday. and ensuring that we have all that data before those kids come back.
It's a day by day thing. Yesterday, I had a really busy day with some things that came through in my building.
Yep.
There's a lot of phone calls, a lot of follow up. Trying to track it is not something the nurses are super experienced with, but we're getting better at it. You see our spreadsheet, Jim. What is there, like 300 or 200 plus cases that we're all trying to keep on top of. We're so afraid we're going to miss a case here and there. Ed's doing a fantastic job weeding through the cases that come in. It's just a daily grind, but we're pushing through.
You know, and just on a side note too, you know, we're the only town, you know, that has the ability to do our own testing. And, you know, over the last couple of days, we've tested quite a few school staff, but in total, since October 9th, we have tested on our own here almost 300 people.
Right. So the other, I guess the other piece that I want to just really briefly talk about, and I mentioned it, and there'll be more to talk on Thursday's school committee meeting, but for the community, we are switching to Thursday meetings, and so twice a month, the first Thursday and the third Thursday, partly because one of our members is on the MASC, the school committee board for our district, and this will work well for those meetings. So there's a potential that these Friday mornings, I know we have a number of repeat visitors here. Joanne, how you doing? And so we may in fact have discussion on the Thursday night of those school committees and not have the Friday meeting in the morning. So just I will send a note out if we make those decisions to the community, just so you know. But instead of having a 2 days back to back. Athletics is on the list, but again, right now I'm just proposing that we begin athletics since we'll be in the hybrid model on Tuesday. And while we talked last week about academic decisions with regard to the policy, that will be taken up at Thursday's meeting because we needed time to adjust the agenda to make it live. People can still practice at that point. It's just that we can't vote on it yet until we actually have it on the agenda. And other than that, we have some professional development today in the schools. We are looking at working with a lot of our staff. Hopefully they sign up for an opportunity to learn more about streaming their classrooms, and we'll be moving in that direction come February 1st to meet our student learning time. Thank you to, I see Chaz on here and Michelle and a couple other board members, and thank you for their work in working with us and our admin and trying to find a seamless way to provide more in-person learning for our, in-person I mean, virtually synchronously for our students across the district, mainly focused at the middle and the high school. So that's really where we are this week. It's feel better based on where our numbers are, getting fewer and fewer calls from Ed and Audrey at night, which is good. But it's still a lot of work. I don't want anyone to walk away from here thinking that it's all rainbows and unicorns. It's not. It's still a grind, as Audrey said. I think it's the best way to put it. It's a grind every day to make sure that we are capturing what we need to capture, that we are quarantining and isolating where we need to, and that we're being as conservative as an approach to ensure the well-being and safety of our faculty, staff, and our students who come into the building. And I keep emphasizing that I believe our protocols work when we're in school and we're wearing masks and we're staying 6 feet apart. And I want to continue to emphasize that school is a safe place for our faculty, staff, students, and community.
So Lori, I remember, I think the way we handled this before is that we had taken the vote to go to remote until January 4, and then as has happened in the past, Jim has made building-based decisions. So I don't think we need a vote to support Jim's recommendation or decision, but I guess I want to.
Consistent with what we did
record
for the
and
rest
say
of the district, we do.
What's that, Paul?
We did for the rest of the district. Even though we'd done exactly what you said, we did
Yep.
vote to go back to hybrid.
So I'll make a motion for the record to have the high school go back to hybrid effective Tuesday.
I'll second that.
We have a second for that?
Paul?
Did you second that, Paul?
Yeah.
Yeah,
I did.
and then all in favor? Okay, Paul, all in favor?
Aye.
Kathy?
Aye.
Aaron?
Aye.
Mark?
Aye.
And I for me as well, so that passes. Any other questions or comments for Jim or Stephen? Did you have anything to add about athletics that Jim didn't already cover? We're starting practices on Tuesday, right? Monday's a holiday. And just to reiterate what Jim said, on the schedule for next week is a Thursday night meeting as well as a Friday morning meeting. But if we cover all of the COVID business on Thursday night and we find that the Friday meeting isn't necessary, then we will be canceling that on Thursday evening. So before you get up early and tune in on Friday morning next week, make sure that you've checked with how we left it on Thursday night. Anything else before I ask for a motion to adjourn?
Just like to acknowledge everybody's efforts in pulling together the testing. I know we kind of talked about this at our meeting on Wednesday, but there weren't many people there. So I just want to take a moment to recognize Jim's efforts, Audrey, Ed, so many other people, Kelly, Stephen, that helped to bring the testing program to the high school and to the community on Monday. I think that was remarkable work in a couple days' time. So that certainly made it a little bit easier for us to feel confident in the level of spread among our high school students, at least. And I think certain for me makes me feel more comfortable with the motion that we've passed today. Thank you all.
Yeah, thanks for bringing that up, Mark. Ed, I think you had left the meeting the other night when I shared about the testing day, which I was able to attend for the whole day. And I just want to thank you and everybody involved. It was put together very quickly and very efficiently and very safely, and the day went very smoothly with all of the admin showing up to help and some volunteers showing up to help. And thank you again for everything that you're all doing for our community. We appreciate you. All right.
I'll move to adjourn.
I'll second.
And then all in favor, Kathy,
Aye.
Aaron,
Aye.
Paul,
Aye.
Mark.
Aye.
And me. Thank you again, everybody. Have a good weekend.
Thank you.
Thanks,
Take care.
everyone.